When Lulu first experienced symptoms of prolapse, she was actually 33, so it was after her delivery, and that was before she had known me. And eventually she needed to have surgery, so I think she underwent a vaginal prolapse repair. When I first met her, she started having recurrence of her symptoms, and it got to the point where it was bothersome to her.
I'm very active. I go to the gym, I like to run, I like to hike, and in one of those activities, I felt something down there. Very uncomfortable. It's like you feel like you're always wet and you're not.
Pelvic organ prolapse is where basically there's a weakening of connective tissue in the pelvic floor muscles. It allows for the pelvic organs like uterus, bladder, and bowel to kind of move from their usual spots. And she actually underwent some pelvic floor physical therapy for a few months, which alleviated a lot of her back pain and pelvic pressure symptoms, but she was still being bothered by her vaginal bulge. And at that point, she decided that surgery was the best option for her.
She was so calm. She explained everything with detail. This is how it's going to be, and this is what's going to happen, and this is your care afterwards.
Not every prolapse is the same, and not every woman is the same. We would like to approach it in an individualized situation. So in Lulu's case, she underwent a robotic sarcrocolpopexy, so we were able to do the same surgery through small incisions. There's a graft that we use to reinforce the backside and the front side of the vagina, and then attach it to a ligament that's overlying the sacrum to kind of restore vaginal anatomy. The small incision allows for less pain, quicker recovery, faster return to activities.
I can wear heels again, I can walk fast, I can do everything that I used to do with no issues at all. No more pain, no more feeling that I'm wet, nothing. It's great. My self-esteem is back to normal, very confident. She did send me to a pelvic flooring therapist who is wonderful, and they teach you how to do exercises.
She did great. I mean, she did not have much in terms of pain at all. There were still things that she wanted to do with the therapist to strengthen her muscles so that she's able to do more.
I share my story first to people, tell them this is what I went through and you don't have to go through this. You know, there's options.
We can explore all the different arrays of options that are available. And if surgery is needed, most of the time we're able to do it minimally invasive, so either vaginally, laparoscopically, or robotically. You know, knowing that pelvic floor issues are really common. You're not alone.